Every year, we wrap presents in beautiful paper. We tie them in ribbons and bows, and we carefully choose each one, hoping it will say to someone we love, "I see you, I know you, and I want to bring you joy." But there exists another kind of gift, one that arrives unwrapped, one that couldn't possibly fit beneath any tree, one that isn't given to a single person, but to generations yet unborn. It's the gift of hope, courage, and sacrifice given by those who step forward to participate in Alzheimer's clinical trials. I call it the ultimate gift. My mother is one of those volunteers. In 2019, she said yes to the Leqembi clinical trial. This was back when nothing was guaranteed, when outcomes were completely uncertain, and she had every reason to be terrified. Because she said yes, because she chose courage over fear, our family has been given something I can only describe as extraordinary. But her gift isn't just to me. It's not even just to our family. It's to people she will never meet, in times she will never witness, and for generations that don't yet exist. That is the immeasurable power of clinical trial participation. Hi, I'm Terry, and this is Surviving Alzheimer's: Clarity, Courage, and Care. This episode is more of a love letter or a thank you note. It's an acknowledgement that's long overdue. It's for my mom, who 6 years ago walked into uncertainty with more courage than I think I fully appreciated. That I know I did not fully appreciate at the time. It's for the 1,794 other volunteers who participated in the Clarity AD trial alongside her, whose combined courage made Leqembi possible. It's for the 1,736 people who enrolled in the TRAILBLAZER-ALZ 2 study that made Kisunla real. It's for every person, past, present, and future, who has ever said yes to Alzheimer's research. When outcomes are uncertain, when personal benefit isn't guaranteed, and when they had every reason to be afraid. Because here's what I've come to understand with absolute clarity. Behind every breakthrough treatment stands an army of heroes. Most of us will never know them. Behind every FDA approval is a volunteer who trusted science when it asked them to be vulnerable. Behind every family that receives hope today is someone who said yes yesterday, or 10 years ago, or even 50 years ago, believing their sacrifice would matter. And they were right. It did matter, immeasurably. Today, I want to honor that gift. I want to make visible what often remains invisible. I want to speak gratitude out loud, because silence doesn't serve us, and those heroes deserve to be seen. Let me first start by being completely honest about what we're facing. Alzheimer's disease is not a polite intruder. It doesn't knock gently and wait for permission to enter. It storms through the door, It rearranges everything you thought was permanent and systematically robs families of their most precious possessions. It robs them of memory, of independence, and of connection. For decades, really generations, treatment options were devastatingly limited. When Mom was first diagnosed with mild cognitive impairment, she asked the neurologist, "What comes next?" And that monster of a neurologist looked at her and said, "Well, Alzheimer's, of course." Kind of like, duh, you idiot. She might as well have punched my mom in the throat. At some point, someone handed her pamphlets about memory care facilities and grief support groups. That was it. That was the plan, to watch and wait, to manage symptoms and prepare for the inevitable decline. And now looking back at it, in hindsight, that direct message from that monster was a blessing. It brought the fighter out in my mom, and we found Kerwin Medical Center. Most doctors simply gaslight their patients and prescribe Aricept. They tell them that memory loss is a normal part of aging. Unfortunately, this is communicated at the best time for someone experiencing memory loss to meet with a neurologist and learn about the treatments that are available. Today, something fundamental is slowly shifting. We're entering into a new era, an era of disease-modifying treatments, an era with Leqembi and Kisunla. These are medications that actually measurably slow the progression of this disease. Are they cures? No. And I need to be absolutely clear about that. They are not cures, but they represent something we thought was impossible. It's a way to give families more time, more meaningful moments, more memories, and more hope. And here's what we must never, ever forget. None of this would exist without volunteers, people who raised their hands and said, "Yes, I will do this." Think about that for a moment and let it really sink in. Every medication you've ever heard about, every treatment that's given anyone hope, exists because real human beings, people with names and families and fears, they agreed to step into uncertainty. They didn't know if it would help them personally. Most participated knowing they might be in a placebo group. Some experienced side effects without seeing any improvement. Some gave months. Most gave years to research that didn't directly benefit them in their lifetime. And yet, they showed up. They allowed their brains, their lives, their precious remaining time to be part of a monumental search for answers. They did it for their children. They did it for their grandchildren. They did it for strangers, people that they will never, ever meet. They did it for all of us. And that is what I mean when I call it the ultimate gift. My mom is one of those volunteers. In 2018, she found an ad in the Dallas Area Seniors Blue Book. Inside that book, she found an ad for Kerwin Medical Center. After months of heartbreak and research, she found a doctor who said she was treating Alzheimer's disease. It took a few months for her to gather her courage, But soon she called them and scheduled the first appointment. That was the first time we learned about BAN 2401, which later became known as Leqembi. At that time, the questions far outnumbered the answers. Would it help her? Would it hurt her? Would she be in the treatment group or just receive a placebo? Would there be side effects we couldn't predict? Would the time commitment with biweekly infusions for 60 months, 5 full years, 2 annual MRIs every year, follow-up PET scans, multiple lumbar punches, and 2 annual cognitive assessments, would it all be worth it? Would it make any difference at all? None of those answers were guaranteed. None. As a family, we all discussed it. After going through it with my grandmother, we absolutely knew what would happen if she didn't do anything. But as we discussed it, she asked us if this could help me, my kids, my nephews, my future grandchildren, and someone else's family. Isn't it worth trying? We were also focused on protecting her, on weighing the risk and benefits for her, that we almost talked her out of it. Thankfully, and I'm grateful that we didn't, because what unfolded over the past 6 years, I can only describe as extraordinary. Her cognitive decline slowed in ways that we hadn't dared to hope for. Her quality of life improved measurably. We have been given time, not just measured in abstract months or, truthfully, in abstract years, but in actual, tangible milestones. I thought Alzheimer's had already stolen from us. I got to help her choose her wedding dress when she remarried recently. That is a moment I never expected to experience. I've watched her laugh, genuinely laugh with friends at gatherings, not the polite smile of someone trying to hide confusion, but real, authentic joy. I've seen light in her eyes, that recognition, that presence. I've seen that in her again. We've had conversations that I will treasure. We've built memories I'll carry forever. We have been given years I did not think that we had. But I've also seen her experience 7 different ARIA events. ARIAs are brain swelling and brain bleeds. She's experienced both multiple times. And after all of the MRIs and other tests came back early on in the trial, we assumed that naturally she would quit the clinical trial. But nope, not my mom. She's a fighter. And she continued the medication because she knew the research doctors needed to learn more about how to treat ARIA and determine the best dosing. We had to stop and reassess her participation a few more times because she continued to experience ARIA events. And as I think back on it, who says yes to brain bleeds? Well, Gail Youngdale did. She would not quit, and she continued the biweekly infusions until Leqembi was approved by the FDA. Then she started another clinical trial for the auto-injector delivery method. She received 2 shots in her belly every week for years. But here's the truth that humbles me completely. Her gift is not just to me. It's not just to her children or her grandchildren. Because Mom was one of 1,795 volunteers for the Clarity AD trial. Leqembi received FDA approval because of her courage and the courage of 1,794 other volunteers she has never met. Millions of families across the planet now have access to treatment they would not have had otherwise. Because Gail Youngdale said yes in 2019 when outcomes were completely uncertain, her grandchildren's children will live in a world where Alzheimer's is no longer the terrifying diagnosis it is today. They will inherit hope instead of fear. If needed, we will all receive effective treatments instead of helpless watching. Those grandchildren and great-grandchildren will grow old without the shadow hanging over every forgotten word. That is the immeasurable power of her gift. One person's courage. One person's courage. One person rippling across generations forever, touching families she will never meet in times she will never witness. How do you begin to say thank you for something that profound? My mother's story is deeply personal to me. Of course it is. She's my mom. But her story is not unique. Right now, today, as I'm recording this, thousands of people with Alzheimer's and their families are stepping into clinical trials. Some are in phase 1 studies of completely experimental medications. Some are testing prevention strategies for high-risk individuals who don't even have symptoms yet. Some are participating in research that may not yield results for another decade. And let me be really specific about what this means, what clinical trial participation actually requires, because I think sometimes we gloss over the profound courage involved. Trust, faith that the doctors and researchers genuinely have your best interest at heart. Even when outcomes are uncertain, trusting a system that's asking you to be incredibly vulnerable. There are physical demands, frequent brain scans, regular infusions that take hours, blood draws, cognitive testing that highlights and points out your decline in real time. There are monitoring visits that require travel and time that they have precious little of. There's always the risk, the possibility of ARIA, the brain swelling or bleeding that shows up on MRIs. There are other potential side effects that can't be fully predicted. The very real chance that the medication might not help you at all, or that you'll receive a placebo while your cognition continues to slip. There's an emotional toll, sitting through cognitive assessments that measure your decline, seeing the concern in your study partner's eyes, facing the reality of your disease repeatedly, month after month. Then there's time, years of commitment with appointments, scheduling, coordination, energy, and resources that sometimes you barely have. And through all of that, there's the uncertainty and the fear and the sacrifice. volunteers hold onto something even more powerful, and it's hope. Hope that their participation matters, even if they don't personally see dramatic improvement. Hope that their contribution will help someone else's mother, someone else's father, someone else's beloved family member on the other side of the planet. Hope that by stepping into uncertainty, they're helping build a future where Alzheimer's is no longer a death sentence. And they're right. That hope is justified because every single volunteer, every single one of them, contributes data that researchers use to understand disease progression, treatment side effects, profiles, and optimal dosing. Every volunteer helps establish whether a medication is safe enough and effective enough to receive the FDA approval. Every volunteer is quite literally changing the future of millions of people that they'll never meet. That is extraordinary. That is heroic, and that deserves to be honored. Let me get really concrete for a moment about what these volunteers make possible. Leqembi, or lecanemab, was the first FDA-approved treatment proven to slow cognitive decline in early Alzheimer's. It was approved in January of 2023. It exists because 1,795 participants enrolled in the Clarity AD trial. Kisunla, or donanemab, was approved more recently after showing similar promise. It exists because 1,736 participants enrolled in the TRAILBLAZER-ALZ 2 study. Future treatments currently in development pipelines, medications that will be even more effective, that may work earlier in the disease process, and that one day may eventually prevent Alzheimer's altogether. They depend on volunteers willing to participate in phase 2 and phase 3 trials right now, today. Prevention trials for high-risk individuals like myself who don't even have symptoms yet. They require thousands of asymptomatic volunteers willing to undergo treatment and monitoring for years before they even know it will work. Behind every statistic, every efficacy percentage, every safety profile is a real human being, someone who said yes when it mattered most. Think about the ripple effect. Let's say a 62-year-old grandfather participates in a trial today. The data from his involvement helps researchers understand optimal dosing. That knowledge contributes to FDA approval, and that approval means his grandson's future children may never feel Alzheimer's the way we do today. If a mother enrolls in a prevention study and receives an experimental treatment for years, decades later, that research becomes the foundation for medications that prevent Alzheimer's in high-risk individuals. Her daughter or daughters will grow old without knowing the shadow that haunted her mom. One person's sacrifice creates ripples across generations, across the planet, that never end. One person's sacrifice creates ripples across generations that never end. That's not an exaggeration. That's literally how medicine breakthroughs happen. Not through sudden flashes of genius, not through isolated laboratory discoveries, through the collective courage of thousands of volunteers saying yes across years and decades, saying, I will give my story, my time, my body, my health, so that one day others will not suffer like I have. So here we are in another December, in another season of giving, and I find myself overwhelmed with the gratitude for gifts that don't come wrapped, for sacrifices I can never adequately repay, for courage that changes everything. To every volunteer in every Alzheimer's clinical trial, past, present, and future, I want to say this. Thank you for your extraordinary bravery. Thank you for your trust in science and researchers when outcomes were completely uncertain. Thank you for your willingness to face risk you had every reason to fear. Thank you for giving the world something that cannot be wrapped, but can fundamentally change lives. Thank you for showing up for appointments when you felt exhausted. Thank you for undergoing the MRIs when you were frightened about what they might show. Thank you for answering the same cognitive test questions, even when they highlighted your decline in painful ways. Thank you for sitting through infusions that took hours of time you had precious little of. Thank you for giving hope to families drowning in despair. Thank you for believing your participation mattered even when you couldn't see the results. Thank you for choosing courage over fear. Your gift is the reason we have treatments today and the reason we will one day have a cure. And to my mom, specifically, Mom, thank you for saying yes in 2019 when you were frightened and uncertain. Thank you for showing up to every single appointment, even when you were tired, even after we lost Dad. Thank you for trusting me as your study partner through your infusions, your MRIs, and the cognitive assessments. Thank you for your courage that gave our family more time together. Thank you for your sacrifice that gave millions of other families hope. Thank you for this ultimate gift. I love you. So, how do we honor this gift? How do we carry it forward? I think there are a few concrete ways we can do this as individuals, as families, and as communities. First, we can support research. We can continue to raise awareness about the clinical importance of clinical trial participation. We can continue to fund studies. We can continue raising awareness about the clinical importance of clinical trial participation. We can continue to fund studies through donations to Alzheimer's research organizations. We can celebrate scientific breakthroughs and the people who made them possible. We can share information about available trials with eligible families. And second, by considering participation ourselves. If you or a loved one is eligible, explore clinical trials as a way to contribute to progress. Discuss trial participation with your neurologist. You could visit clinicaltrials.gov to search for opportunities near you. You can join registries like the Alzheimer's Prevention Registry to be notified of studies. Third, By carrying their story, remind the world that every single medication, every breakthrough are real people with names and families and fears, people who chose courage, share the stories of sacrifice, and advocate for continued research funding. Teach the next generation about the power of medical research participation. Because here's what I've come to understand. The ultimate gift of clinical trial participation is not seasonal. It doesn't fade when December ends and the decorations are packed away. It lasts forever, preserved in scientific data, manifested in new treatments, and alive in families who find hope where once there was only darkness. It is quite literally the gift of life and memory for generations. If you or someone you love is living with memory loss, or if you're considering participating in an Alzheimer's clinical trial, know this: you are not alone. At Memory Treatment Advisors, I help families navigate these profound choices with clarity, compassion, and courage. That comes from walking this path myself. I can help you understand the available clinical trials that are available and the eligibility criteria. I can help you weigh the benefits and risk of participation. I can help you navigate the enrollment process and prepare for what trial involvement actually means. I can also help you explore FDA-approved treatments like Leqembi and Kisunla and develop prevention strategies based on current science. You can book a free 10-minute clarity call at memorytreatmentadvisors.com. Just go to the schedule button. This December, when I sit at the table with my mom, when I watch her smile, when I hear her laugh, and when I see the light still present in her eyes, I will be overwhelmed with gratitude. Gratitude for her courage 6 years ago. Gratitude for every person who has ever said yes to Alzheimer's research. Gratitude for a gift that keeps giving across generations. Because one day, when future generations ask, what is Alzheimer's? We can tell them the story. We can tell them how we got treatments because thousands of volunteers said yes. Thank you for listening to this deeply personal episode. If it resonated with you, please share it with someone who might need to hear it. Leave a review, subscribe, do all the things. And remember, we do this with clarity, courage, and care. I'm Terry. Until next time, take good care of yourself. And if you are a clinical trial volunteer, thank you. Your gift matters more than you know.